Greetings, everyone, in the wonderful and mighty name of our Lord and Savior Jesus. Wherever I go, I will say that because
Amen.
I am standing today because of His grace. I've been sick. I've been sick for 2 months. Yeah, it's like I woke up yesterday and I started feeling much better, and I realized it's the fight, it's the anxiety every day of being an autism mom. I didn't realize how much this was too much for me in terms of my mental and physical health. That last month was a reality of being an autism mom. My name is Matseke. I am a mother to a 21-year-old son who was diagnosed with autism by the age of about 2 years. I'm also a speech therapist and audiologist by profession. I was a speech therapist prior to having my son. Little did I know that that would actually become a calling, not just a profession. Because now I'm living with the realities of raising a child with communication difficulties, a child with difficulties with social interaction, a child with mental health issues, and it's quite a lot. And my journey started, like I said, at about 18 months when my son was diagnosed with autism. And at that moment, you can imagine he's 21. There was not so much information, there was not so much advocacy work that was done, and as a parent, it was very difficult for me to navigate through the journey of, my son's diagnosis. I remember going to a neurodevelopmental pediatrician, and the one thing we do as professionals is, we tell the good news, like we tell the diagnosis as if it's good news, because I figured it's autism, but you don't really understand how the parent processes the information and the manner in which you give out that info. Do you even consider having a psychologist with you to go through the process with the mom? And you also bombard the parent with a lot of information. So as medical professionals, we need to be sensitive as to how we give out information. Give it with like small doses of information. Don't bombard the parent with so much information. I was told, go and do blood tests there, go do, I had to do the EEG, I had to do a lot of other things, So it was just so much. And 1 minute you're doing this, you don't even know which one to start with, because my son actually initially, I was lucky that I was able to pick up that my son is autistic prior to him being diagnosed. So it was like, okay, I see the red flags. And then as an audiologist, because he wasn't responding, the first thing that I did was to test his hearing. And when I tested him at the time with my colleague, we also picked up that he's got middle ear infection. So it's quite a lot that you're dealing with, because remember, this child not only presents with just autism, it comes with the other underlying conditions, like they always say with the gut problem, that you have these kids who, I even think even their immune system is a little bit compromised, because it was the child who's more prone to ear infections and all that. So whilst I just finished, as in treatment for the middle ear infection, then something came up, because initially it was that red flag, or to say maybe let's start with the hearing. But after we did that, it was just me now starting to see a child who's completely different. It's like he's blanked out. He's here, but not with me. It's like I lost my son, because he could speak, he could count. But then suddenly, somehow, he lost those milestones. And little did I know, as a professional, that you could have a regression type of autism. Because I thought you are just born with autism, but as a mother, I picked up that my son was developing normally in terms of all the developmental milestones, but at some point he started losing those milestones. He started losing his speech. He could sing, he stopped singing, he stopped looking at me, he was playing with his fingers at night and singing, and as a parent, what would you think if your child starts playing with their fingers at night and singing? It's quite scary, you know. Part of you says, hey, hey, and then the medical part of you says it's autism. So it was those two contrasting, you know, emotions that I went through. And as a professional, obviously, I had to go through the diagnosis and all that. And yeah, that's when the doctors actually confirmed that my son is autistic. Then comes the next stage. The next stage of after you've received the diagnosis is the treatment. At the time, there's not many speech therapists who are trained with regards to autism. So it used to be a traditional speech therapy. There were no Makaton at the time. There were no teach. There were no PECs. There was just not so much in terms of what's available to be able to intervene. But obviously, you could still do your early intervention with regards to language stimulation. But again, it's difficult to do it when your child can't even sit still. So then we looked at the issue of having him on medication. And guess what? You're not told that you give your child this particular medication and then you see certain behaviors. Like my son now started, he was on Epilim, because when they did it, the EEG, they found out that he's got absent seizures. So now you're dealing with, it's a lot. Imagine in one person, you've got this diagnosis, you had the hearing problem, you had the seizures, you have the mental, you have the communication, autism is another thing. I tell you, it's like one of those worlds where you just don't want to go there, because you try to fix something comes up. Then my son had Epilim. As soon as we gave him Epilim, what happened? He started biting me. Then he started to have this aggressive behavior. The very thing that is supposed to help your child isn't working. And what do? I just stopped giving him the medication and just let him be. And then when I let him be, he's hyper, he climbs on the bed, he cuts things, he breaks things in the house. It's just a chaos. You are a married woman at the same time. You've got your spouse who needs your attention, and here's this child who needs, so it's just a lot. Just you as a parent having to go through that. And because at the time there wasn't even that network or support and no one to speak to and explain to them that this is what I'm experiencing. And what about you? Did you experience 1, 2, 3? I couldn't even phone my clients. I can't phone my clients and say, hey, Matseke, I'm going through this. You can imagine you've got that relationship, you as a professional with your clients that you are treating. So now I was there stuck by myself, and you suddenly go through your own depression. So we know with the diagnosis, initially it's the denial. I've been there. Hashem, Kile, go, St. John. Even as a Christian, I went to St. John just to get something like a miracle cure. For St. John, but 7 times, and this autism is going to disappear. 7 times. Guess what? We came out still no improvement. I can ZCC. Artificial ZCC. Libona. Been there, done that. And I want to say that it helped me. It also helped me in my practice when I was with parents and when I give out the diagnosis. I've seen parents who deny, and I don't blame them. It's very difficult to accept this diagnosis. It's like being given a life sentence. And if you know what autism is like, you can almost like predict what's gonna happen. For me, it was like me playing it over in my mind. He might not even go to varsity, he might not even be able to speak, because you've seen it before. I thought the little I knew about it, it would have been better. But fast forward to my journey of denial, somehow, okay, it's the denial, it's the bargaining. It's when you are going to those matandazeli, you've been to this one and that one, you're trying to bargain with God to say, maybe you could heal my son. And then the third one. And there's anger in between. Again, there's also anger. Again, and then you go to that stage, depression. Then depression is that stage where you are just all by yourself in this world. You cut your friends, you cut your social life, your life just revolves around this child. You don't even care about many other things. It's this child that I'm supposed to take care of. I remember times I'd go to work and dreaded coming back home because I'm going to have this child who's going to scratch me. And getting back from work was terrifying. And I'll try to hug my son, and guess what he's going to do? And what is it going to do? Anxiety, depression. I didn't even seek medical attention. I didn't get any psychological intervention in terms of me being counseled and my husband. And at the time, it also even affected my marriage. Fast forward. I went through all of that, and then the struggle now. You have to place your child at school. Guess what? There aren't schools for children who are autistic. Now your child has to be placed in a special school, but there isn't. And at the time, luckily, I was staying in Alberton, and there were private schools that I could take my son to, because your public special schools didn't have space. So I put him at Mayville, which is a private nursery school. And guess what? It's not even autism specific. They have CP kids who are in that school. And the other day I went there, my son fell with his head and nobody was looking after him. It was just stressful. And I was put on a waiting list at Johannesburg School for Autism because it was the only school I knew at the time. And I think there was also Key School. And he got accepted, I think, at the age of 6, but around 3, 4, 5, he was still at Mayo, and that means he didn't receive the right intervention because they also didn't have programs, so that delays your child's improvement. Then he was at Johannesburg School for Autism, but what I'm trying to say is that I'm giving you a holistic picture of just the life of being an autism mother and all that we go through. Then I had to come to a place of acceptance. And when you get to that place, you've done that, you've been there and whatever, but I thank God that in me trying to accept the condition, I started to empower myself as a professional to say, man, this thing, if now it stresses me, how much more a mom who doesn't even have the information that I had. So I needed to get myself out of that pity party, and then I went and did courses like, I was listening to you, Doctor, talking about ADOS, talking about, the long waiting list for assessment, and I'm thinking in South Africa, we as professionals, we need to get together and see how best we could use our skills, because, it's not a rocket scientist thing to assess autism. It's OT's speech, I think we possess the necessary clinical skills to be able to do the diagnosis. I've done ADOS training, but unfortunately in South Africa they say you have to be a neurodevelopmental pediatrician to do the diagnosis. How many times we're taking kids to the pediatrician who doesn't even have a clue that this is autism? I remember taking my son to the pediatrician, and she just looked at my son, she says, he doesn't look like he's got autism. How do you see it? Because it's a more of an interactive approach when you do the assessment. And if you look at the whole thing, it's more your speech, it's your social interaction, it's your behavior. What is so rocket scientist? That we as South Africans, we need to come to a place where as professionals we get together, we come up with maybe some ways of training that people could be qualified. And obviously it has to be medical professionals that should actually be given, especially in areas, in the rural areas as well. Even us here, because like we say, we're servicing a lot of people, and just find ways that people could, within the framework and the scope of practice, and ethically so, be able to diagnose or assist in the diagnosis of autism. But that's just the sideline. So I empowered myself with regards to all that and went to do various courses pertaining to autism. And that's how this organization, Mothers of Children with Autism, was formed in 2015. I started a support group at Natal Street, which is now called Tele Mokperani Hospital, and since then it grew from strength to strength. As I'm talking to you, we now have about 550 moms, 500 plus minus 500 in our WhatsApp group that we share information with on a daily basis, and this has become a lifeline that has assisted a lot of us, because a mom can ask a question and there's always somebody to assist, and especially those who've actually raised their kids for like 21 years. We've gone through those stages. And the other thing we're not, with autism is that as the child goes through different stages, they start presenting with different behaviors. Like Sis Ntombi, you were talking about your son now, who's already now at the puberty stage. You're gonna find that it's gonna be difficult to restrain him. It's gonna be difficult to discipline him. You have to re-look at your medication. Is it working? And that's what we did with my husband. We looked at our son and we thought, now he needs to be given other medication that could help a bit, and that also helped. And also with the behavioral ABA, maybe I'm not sure if you can get somebody who's more of a behavioral interventionist. Do they call them? Yeah, someone who can help you with the child's behavior, be it a psychologist who can come to your home environment to be able to tell what are the triggers. Because I know some people are very anti-ABA, but the theory, when you listen to it, somehow it does seem to help, because it gives you an idea what are the triggers and how do you prevent such. Yeah, so having said that, the MOPA has grown phenomenally. You were saying something about the puberty? Yes, and the changes in the hormones and the changes with the hormones, and we know that our kids at that stage, they also fiddle with their things, and you also need to be looking at other medication that can help, because they do it privately and all that. In public, you have to teach them that they have to do it privately, and there are books as well to help with that stage of development, adolescence. I think Autism South Africa does have the booklets that talks about puberty. So that information we do share on our MOPA support group, and we have been hosting high teas. So this year we're turning 10 years already, and yeah, the platform has grown phenomenally. And this is the book that I'm going to quickly share with you. We also developed this booklet called the Autism Information Guide booklet for caregivers from the moment of diagnosis, and it's got list of service providers where you could go to get assistance, and also how do you apply for disability grant, how do you apply at a school, special school, and it also has, for tax rebates, how do you get your tax rebates, and many other things that you as a caregiver requires. So we will be leaving some of these booklets here so that you can give out to some of the parents. And please, can we create a partnership and work together? I think the problem in South Africa, we're all working in silos. Autism South Africa is doing this, MOPA is doing this, someone is doing this. We should come together as a group, as a collective, and see. We do have wonderful resources in South Africa. It's just that, the other day I was sitting at a plenary meeting for a conference that is supposed to take place. And as I'm sitting there, I realized just how we're still working in isolation. I was expecting that I was gonna see people from health, and they only put mental health, but they didn't put like your doctors, your neurodevelopmental, so I still feel we still have a long way to go if we still gonna work in isolation. But the word that I'm going to say to you out there is that please, let's support one another, especially when it comes to autism, because they say it takes a village to raise a child. And everyone who's here today, you've got a responsibility to not judge But to have the empathy, if you see a mom at the mall and the child has got tantrums, you don't discipline your don't, because you don't know what that mom is dealing with. In actual fact, you could just ask, how can I help? How can I help? So let's be sensitive and happy Autism Awareness Day.